Hey, welcome back to the Human Performance Project. While there's many good uses for foam rollers, this rolling around on the floor aimlessly to try to improve your thoracic mobility is not one of them. There are some good things we can do with a foam roller to help our thoracic mobility, but for now, let's just get rid of it, right? So if you've been having some middle upper back pain, or you can't get your hands over your head because you're super stiff there and you feel tight in your mid-back and you can free it up and get your hands over your head better, here's a couple of drills for you. That's gonna be our focus this week. How do we improve our thoracic mobility? Get rid of your mid-back pain and or improve your front rack and overhead position. So an easy one is gonna be just using a wall. That's pretty good because you might get some shoulder mobility in there as well. However, if it hurts your shoulder, stop, right? So all you need is a wall or anything to rest your hands on. Hands go on the wall, feet go back, hinge through your hips and drive your chest down to the floor there. And as you do it, think about extending the back, right? You can turn your hands out if you want to, doesn't matter, right? Just drive that chest down to the floor, extend the back and push there, and you can hang out there for a few seconds, right? We're not gonna hang out there with our hands over our head for 2 straight minutes though. What we can do is 20-second intervals 6 times, right? If your hands start to go numb or tingling, bring them down. Get some blood flow into them. After you do that, let's follow that up by actively using some of that range with a quadruped on your hands and knees, extension rotation, right? That sounds fancy, but it's not that fancy. So just go on your hands and knees, right? And you're gonna put one hand behind your head, and you're gonna kind of thread the needle, so to speak, right? Put that elbow through and then drive it all the way up and look where you're going. The problem with this though is that we move to our lower back. So we're gonna take that out by sitting our butt back to our heels. So now we only move through our thoracic spine and not our lumbar spine. So we come here, drive down. You can exhale into that stretch, hang out there for a couple seconds. Inhale in the middle. And then as you start to come up, exhale into the stretch again. And think about driving that elbow and shoulder blade back, right? And you can go through that 15 times on one side, same thing. Exhale here, come up, look where you're rotating towards, drive that elbow and shoulder blade back, hold for a couple seconds, and go through 10, 15 times on that side, and go through that for 3 or 4 cycles, all right? And then test, retest, we can put hands overhead and see how it feels before and after we do that. So guys, like it, share this with your friends, tag somebody that needs it, and we'll see you next time on the Human Performance Project.